Professor Farley, I can honestly say in my amateur walkthrough of science, I've never seen a division so wide. How do you respond to further draconian lockdowns in Europe versus the nirvana of what we see from the governor of Texas?
Well, good morning, Tom. It's certainly a confusing state of affairs for those of us in the scientific community. The Congress had a green light for quite a while, planning on returning a lot of normalcy to the country by Easter, were the original prime minister's plans. And then a case report, particularly in old folks' homes, retirement homes, that showed 1,200 new cases in a single day, 9 deaths, and got a lot of pressure to begin to pull back the lifting of restrictions. Contrast that with Texas, where, as your own reporting has shown, there has been significant delays, particularly in vaccine due to the recent weather conditions, and the governor basically lifting all restrictions across the entire state. We're scratching our heads a little bit about how governors seem to be following completely the business community's thoughts and really ignoring the scientific community's thoughts.
Dr. Farley, help us here with what the Washington Post leads with this today, but I think it's very much in the Bloomberg zeitgeist as well. This virus in the obese, you and your team are in the trenches of the medical care of this. Describe what the virus does to people who are overweight.
Well, certainly. So obesity is a risk factor for more severe disease. Conditions that couple obesity, such as hypertension, diabetes, and others, are also risk factors. So you have a compounding effect of risk. And so once we see the infection, we also see that there may be, with hypertension and diabetes and other diseases, greater number of ACE2 receptors, therefore increasing receptivity to the virus. So potential for infection may be increased. And therefore, once you receive the infection and start to replicate the virus, your immune system potentially responds in a very brisk way. And that subsequently leads to acute respiratory distress, as we've described many times before. So patients who are overweight have potentially multiple competing risk factors that increase the risk of a negative response to COVID-19.
Meanwhile, as we get on our march potentially towards herd immunity, there's still so many basic questions that remain unanswered, such as if somebody's gotten infected, can they get reinfected with COVID? If somebody gets inoculated, can they spread COVID? What are the answers to these very basic and important questions when it comes to getting some sort of protection from this virus?
Yeah, and one can understand the public's sense of confusion with both of these questions. So on the question of reinfection, is that it is more rare to get reinfected, but it is absolutely possible. We've been saying for a long time now that we believed it was possible, and now we have evidence in multiple different ways. First, we've seen reinfection in patients without variants, which is extremely rare. But then subsequently, we see, particularly in Brazil, in Manaus, almost 70% of the city were initially infected, and then resistant infections, or these new mutant viruses, began to pop up, and they evade the antibody response of prior infection, and that's really critical. So yes, reinfection can occur. We've got scientific evidence and proof of that now. In terms of can you transmit the virus after vaccine, none of the studies were designed to answer that question, and that's the key contributing factor to a lot of confusion right now. If we look at the data out of Israel, which has some of the world's best vaccination coverage, it does seem to reduce substantially the potential to transmit virus, up to 94%. And that data continues to emerge out of Israel, providing us data on how we believe that you will likely not be able to transmit the virus. So 2 vaccinated individuals can certainly congregate together. When you get discordance, 1 vaccinated, 1 not, we're still recommending that not occur at this time.
So help me understand this then. Let's go through the data just quickly, Professor. So 15.9% of the population in America right now has had at least 1 shot, 8.1% fully vaccinated. What comes first here? Do we need to achieve a certain percentage before we can tell people who have been vaccinated they can go about their normal life? Or are we waiting for a study? What do you think comes first?
Well, I think it's going to not be a magic pill that we can have the answer to immediately. First, I think small groups of individuals who are vaccinated can begin to, congregate and do things. I mean, we've seen even, the nation's doctor, Dr. Fauci, really talking about how, if members of his household were vaccinated, he would have and be able to welcome them in for a family dinner. And I agree with that wholeheartedly. But when you're like in my household where I have a discordant, I'm vaccinated, my partner is not, I would not do that because that would increase his risk for subsequent infection. I also, as we think about these discordant households, in my mind, we eventually, as we open up vaccination, need to prioritize households in which at least one person have been vaccinated so that you can create a family sense of normalcy as you move forward. For individuals with a single person in the household or for individuals with, in congregate settings, obviously, as we roll out vaccinations, those will be our next tier. But we really need to get the household back into some sense of normalcy by vaccinating its entirety.